Beverly Morgan, and I'm the Director of Business Development at Bridgepoint Healthcare here in Washington, D.C. And why this is important to me to be here on the Hill is because in Ward 7 and 8, maternal health is tremendously impacted. We do not have hospitals in Ward 7 and 8 in Washington, D.C. that has health care for women that are in the childbearing age. And so tremendously we're finding that at 80% we have deaths in Ward 7 and 8 right here in the nation's capital. Yes, we need this to be addressed, and we need legislative support in order to improve maternal health in Washington, D.C.
So you guys, you've traveled from across the country to meet with legislators today. And as you told me earlier on, this is your 36th annual meeting with congressional leaders here.
Yes.
So can you just tell me what other parts of the nations are you from and why it was important for you to be here?
What are they?
I'm Carla Omi. I'm from Louisiana. It's important for me because where I'm from, there's a merge for more RNs versus LPNs in the healthcare field, in the hospitals. LPNs provide for the patients in the hospitals. We can provide more patient care, but we're not being utilized as much as we can be. So I would like to see more LPNs in hospitals, skilled nursing facilities, nursing homes, things like that, instead of being used as nurse aides.
Okay. So what you're saying is, as I understand, there's a lack of nurses across the nation. But there are helping hands in your area that are not being utilized.
We're not being utilized to the best of our abilities.
To the best of your ability.
Right.
Hi, my name is Gail Anderson. I'm from Chicago, Illinois. And the purpose of me being here on the Capitol Hill today is because we're also facing that same dilemma of not having LPNs utilized in hospitals and clinics now. They're taking medical assistants and replacing them versus using LPNs who are more skilled due to the fact that we are in school much longer. So that's one reason why I'm up here. The other one is that we have RNs in Illinois that do not want LPNs in hospitals. So that needs to change, and that's part of what the American Nursing Society Association, says. So that's part of why I'm up here.
Hi, my name is Pat Witherspoon. I'm representing the state of Virginia. I know it's kind of sound like we're doing verbatim, but representing my co-workers and my friends that are nurses, LPNs in the state of Virginia, actually in the city of Newport News. I've received a few letters from some of my co-workers who are very concerned that we're being replaced instead of being replaced by medical techs or either CNAs right now, who don't have the same skills that we have. And then the RNs are pretty much taking our place, but they're not doing the skills that we have. The concerns that the patients are not going to get the same care that we would be able to give them. As they spoke about in one of our meetings this morning, one of the RNs did address that the LPNs are the ones who are skilled versus the RNs, and without the LPNs, there's no care for the patients. The patients are going to lack the care that they need. It's very challenging to my heart. That's why I came into the profession, because of the care that we provide. As in our sorority, Lambda Psi Nu, we are nurses, compassionate care nurses, and I believe in that to my heart. So representing my co-workers, my sorority sisters, we want to continue to see the LPNs work in the facilities that we deserve and that we actually signed up for. So that is my concern right now, that's what we need to continue to work for.
I'm going to allow the rest of you. One question on my mind just listening to you. The Biden-Harris administration from the beginning have invested in making sure regarding the healthcare industry and also empowering, because as I mentioned, there is a lack of healthcare professionals. But what you're saying is there are helping hands there are people that are already trained that are not being utilized. Do you think one of the things that have been reported right now is a lot of these healthcare facilities that are closing, as you mentioned earlier on, are being bought by private equity companies? And they promise that, hey, we bring in this, but once like a lot of things, they come in and they start. So could it be due to cost cutting as a way to save money that they're trying to eliminate because of the amount of money that they will have to pay LPN? As I understand.
Well, so
That's part of it.
I just want to say this. I feel like as a member of National Black Nurses Association, as a member and president and founder of Lambda Psi Nu Nursing Sorority that represents thousands of nurses across the country, we as LPNs can fill in the gap of the nurses shortage in this country. And I feel like the government is misutilizing LPNs in certain settings. There's no reason why LPNs can't be used in acute care hospitals, in clinics, in dialysis, in home care, in hospice. All of the community-based services are absolutely available for us to represent. We have the training, the skill set, the knowledge, the abilities to do great work and to fill in the shortage, the nursing shortage in this country. Now, if training is needed, training is needed. And if you want us to advance to become registered nurses, I think legislation needs to put the funding so that you have a bridge program for LPNs to go from becoming LPNs to RNs in this country. I think that's the best way that we can serve this country best in the healthcare continuum.
What other, asking the other individual, where are you from and why it's important for you to be here?
Yes, my name is Charlene Harada Womana, and I'm from Maryland. And here in Maryland, they have been letting LPNs work in critical care areas such as the ER, ICU, and PCU. And I think that's a start to help. But my main concern being here is about pay. You know, we do the same work. It's only certain things that we're not allowed to do as LPNs. But I still think that the pay should be substantially the same instead of us getting paid less money to do the same job. And also, I think that is very important. The new part here in Maryland is to allow LPNs to go into labor and delivery, which is where they are lacking in nurses. And I think if they bring out a program to assist the LPNs with getting into that labor and delivery and maternal health, that it would help increase some of the issues that they have around infant mortality.
Yeah. Okay.
So, for myself,
I see you nodding.
I'm Alicia Hightower, and I'm actually a nephrology nurse in Virginia. And for me, my heart and my passion is kidney care. And I found that where we are as an LPN, I work as an administrator. However, I have LPN colleagues that we can't utilize on the floor, because if we do utilize them on the floor, they're on the floor as a PCT, which is a patient care technician. So we don't even, as an administrator, I don't even have a budget for LPN. So I think that when I was coming up as an LPN on the floor, I was able to do charge. Now, they can't do charge. We can't do charge in dialysis anymore. CMS has mandated that only your RN can open your building. So if an RN calls out and I can't get another RN to replace, where I used to be able to open my clinic or be able to work my floor as a charge nurse, I can no longer do that. So if I don't have an RN, I can't open the clinic. And I think something needs to be done about that. That needs to be addressed, because where are the patients going to go? If I can't, I'm going to have to send them to another clinic if I don't have an RN to open the building. And we don't have RNs beating down the door for dialysis.
Hi, my name is Denise Broomer, and I'm from Delaware. And
You're from the president.
Yes, And so the reason why I'm here is maternal and infant health, narrowing it down to breastfeeding. I wanted to see more programs where the mothers are educated right from the time of conception when they find out that they're pregnant through healthy eating, more programs that are accessible for them throughout their pregnancy, and then also debunk some of the myths that we have that go along with breastfeeding. You know, just basically educating, and that's the biggest thing, to educate them, letting them know that that's the best form of nutrition for the baby, especially from birth to 6 months and beyond. So that's why I'm here, so we can get that out, so we can have a more healthier livelihood for children, because what we do from the beginning affects them throughout their life, even into adulthood.
And it also affects the mothers. Also.
Yes.
Yeah. Very good. Yeah.
Hello, my name is Kim Cartwright, and I am from Maryland. I am actually the LPN board member with National Black Nurses Association, and also with Lambda Psi Nu. I am here, and I come every year. I've been coming here for probably the last 12 years for many of the reasons that my colleagues are here. And I want to piggyback on what Denise said with infant mortality. African American children are dying at a faster rate than the Caucasian children. And a lot of it is due to access to care. LPNs are now maternal doulas.
Yes.
If we could get funding to support the doulas that are in the community that can help with access to care. Breast milk, there are no guidelines now on selling breast milk. You can buy breast milk on Amazon. So that's a problem, because you don't know where that milk came from. And also with just the LPN being utilized in the hospitals. I was an LPN in the hospital many years ago, but CMS started this magnet program. And, you know, I just don't see how bringing RNs in, replacing the nurses that were already there. So if you want us to be RNs, give us the funding.
And the training.
And the training.
And the bridge.
Yeah, the
Yes.
bridge. Bridging us to an RN, because a lot of us may not have the funding. A lot of us are been nurses for years, and if they would fund us through a bridge program, then we'd be able to support the requirements of the magnet program. But they're utilizing LPNs again now, so thank you.
Hi, my name is Janessa Ramos. I'm from New Jersey. I am the president of the New Jersey chapter for Lambda Psi Nu.
First lady hometown.
So I'm here for the diabetes awareness. I'm Latin, and in the Latin communities, there is a need for nutrition guides. There's a need for wound care. There's a need for just diabetes awareness in itself. And so that's what I'm here for.
I mean, the key things that I'm hearing from you guys is maternal health, diabetes, health issue. You are all wearing red today, and access to elevate your professional credentials.
Yes.
As you mentioned, you've been coming to here every year. Have you seen any changes?
There are some changes in the works, but as you know, with legislation, you have to be consistent and persistent. And so we're constantly going back to our senators and our congressmen and letting them know that these issues are still on the forefront of the healthcare issues in this country. So there are some changes. I do see things shifting somewhat, specifically in regards to education, because if nothing else, the pandemic was inevitably apparent that nurses were at the key in the forefront of the healthcare industry. So at this point in time, you have about 50% of the population that are exiting, doing a mass exit out of healthcare. So we have to rapidly replace them, which is the reason why LPNs are so significant. You can replace a LPN, 4 LPNs in the same time you can place 1 RN.
All right.
So you could put a multitude of people, qualified, trained professionals at the bedside, as well as advancing their education so that they can go to the level in which the magnet status is indicating provides quality care. The other thing is that we can provide certifications so that we can specifically be trained for the particular area in which we serve. That's something that we can do immediately to make an impact and to make a difference in the healthcare industry. So we're here, willing, ready to serve. We just need the support from legislating to open up the door for licensed practical nurses in this country.
Okay. And one other thing that I'm looking at you guys, we talk about representation matters. And a lot of the issues that you talk about, maternal health, diabetes, health issues, these are issues that impact minority communities significantly.
Yes.
And we've seen the devastation of that on from young to old.
Yes.
So can you talk about that, what you're seeing and why what you're doing is really, really important? Why, we are in election year. We have an election coming up and people are worried about. And we have this administration, as I mentioned, their policy regarding healthcare. The vice president has been on the forefront of this about the maternal health, that America, the most developed country, has the most maternal health, and it should not be so. But you guys are not being utilized, as you mentioned, to provide the educations that these mothers, whether they're young or they're old, that they need, so we can reduce this issue. So if you can talk about some of what you're seeing and why your work is important.
So as Lantha Sanu, Nursing Sorority, one of the things, we have several national initiatives, one of which is diabetes. We do diabetes navigation and education, connecting people in the community with education, knowledge on how to manage diabetes, more importantly, how to prevent diabetes. Prevention is key. We don't always want to be curing people with diabetes. We want to be able to prevent them from getting diabetes. So we actually take it upon ourselves to go throughout the country and go into our communities and educate people on how to manage diabetes, but more importantly, help them get access to resources, which is why the American Diabetes Association, the legislative work that they've been doing was so impactful. Being able to allow for people to be able to afford insulin at with a copay of less than $35 was a tremendous feat. So now we can know that we can manage people safely, they can get access to their medications, and they can be controlled in a safe manner and live a quality life as a result of being a diabetic. In regards to heart disease, we know hypertension is on the forefront. Cardiovascular disease is on the forefront. We need to make sure that we have access to healthy foods. Even in the nation's capital, we still have food deserts throughout this country where people can't access this fresh produce. So how are we to think that people are going to be able to improve their cardiovascular health if they can't even get basic healthy foods? So one of the initiatives that we found that has been very impactful is the prescription program for produce. That has made a tremendous impact. So people can get access to produce by getting a prescription card, going to either a farmer's market, or even training them how to grow their own fruit in their community, fruits and vegetables in their own community. It has been a tremendous impact, and it's improving people's quality of health. And we're doing evidence-based work in the community so that we're seeing a difference. So we look at people from last year, and we make comparisons to this year and see if for diabetes, their A1C is improving or their blood pressures are improving. And we're seeing a tremendous impact. But again, we need that legislative support to be able to make those transitions, continue to go into the communities and make a difference and an impact by educating people about their health.
So if you have a chance to talk to the president or the vice president, what will you say? What would be your top 3 things that you would like the administration in these 6 months and hopefully in the next 4 years what will you like administration, whoever is at the White House, to do?
Does somebody else want to talk about that? Do you want me to talk about it?
I will. I would like to see first mental health addressed.
Yes.
Addressing, because mental health touches on everything, you know, from depression on up to schizophrenia. You know, getting the medications that the patients need, Alzheimer's medication. That touches me personally. My mom has a copay for her Alzheimer's medicine. She didn't want to pay for it, but, you know, she needs it. Maternal child health, you know, from the mom to the baby. You know, we want to see the numbers, you know,
Decrease.
changing. Yeah, we want to see, I mean, I don't want to see Caucasians, but I mean, I want to see that the African American numbers come down. Okay, we want to see more access to care, funding for doulas to be in the communities where doctors and nurse practitioners don't want to go. You know, we have LPN doulas that are willing to go to make home care visits, you know, give us funding for home care visits. And third, diabetes. Because with diabetes and heart disease, they go hand in hand. You know, because if you have diabetes, 9 times out of 10, you have heart disease, because diabetes affects the arteries. So we want to see more funding so that we can be out in the communities where there's disparities. We need to be able to reach those people and educate them, as Beverly said, so that we can do follow-up. You know, we need to have the resources. Back in the day, we had physicians that would go to homes. Now they have these HMOs and all of that capping on, you know, the doctor's got to spend a certain amount of time, can't spend more than 5 minutes with a patient. You know, give funding back to physicians so they're willing to make those home visits. You know, fund the rural areas, the areas where there's disparities in Hispanics. You know, we want to just see an equality, equity in healthcare for everybody.
So what I'm hearing is they've made significant investments into the healthcare, as you underscore, like the cutting down the price of some of the prescriptions and diabetes, insulin especially. But what I'm hearing from you is the investment that they have made is not getting to you guys.
To the communities that
Well, it's not
need
getting
it.
to us so that we can continue to help the community. And I want to just share with you one other thing that as a part of our organization is we actually have an international component as well. And so in the last 2 years, we've partnered with the National Association of Hispanic Nurses going back to Puerto Rico and doing community-based work. So you think Puerto Rico is a part of the U.S.
Yeah.
However, their healthcare system is tremendously different from the healthcare services we get here. So we had the pleasure of going back to be servants, to go back to Puerto Rico, and we actually we went to 5 islands. We set up community-based clinics so that people could get vaccinations, COVID vaccinations, flu vaccinations, and we gave them full-fledged physicals. The Department of Health in each one of the islands gave us a list of patients and people who were either disabled or elderly that were homebound. We actually went into the community, into people's homes, to service them with supplies, equipment, and services, as well as giving them a full-fledged evaluation and physical. And they were so grateful and so appreciative. And the things that we did in a short amount of time made a tremendous impact on those people. So we could continue to do that work. So we got to reach beyond the walls of just where we serve. We're willing to go out in the world to make a difference.
And you just need to be empowered.
Yes.
That the investment that they've put in place need to get to you.
Yes.
So we need policing.
Right.
The investment, like, okay, where is this money from and why is it not getting to the people that actually need it?
Yes.
Okay. You know, I always ask people this. Given everything that is going on that you talk about, you are on the forefront, on the front line of one of they said health is wealth.
Yeah.
That's true.
Yeah, that's true.
Anywhere, whether it's America or anywhere, we saw that, as you emphasized, during the pandemic, and how important the healthcare is. We have a very good healthcare in this country. There are many people travel from around the world to come and get care here, but we also need to take care of ourselves.
Yes.
That's right.
Yes.
And we're not doing that.
Yes.
That's what I'm hearing. We're not doing that. We're not empowering the people that are willing to do that. What gives you guys hope? What gives you hope?
Speak about that?
Organizations like ours,
Yes.
partnering with organizations that care. You know, National Black Nurses Association, Lambda Psi Nu, we have the Deltas, the AKAs, everybody that is out there, boots on the ground. You know, even the organizations you don't hear of. You know, just people that are out there doing the work and not sitting in an office looking at a piece of paper. Because on my job, I will say, you know, administration, CEOs, you know, they sit in there, and I'll just say it, in their towers, and you have people on the ground that are doing the work. And it's like, you know, you need to be boots on the ground. We need to have that funding. You need to come and see what is actually happening. And that's where these organizations are doing the work. You know, we have pharma and all of that other stuff, but we need the MedStars, the Inovas, and all of those people to start funding or, you know, providing programs for people that are underserved, and not trying to, you know, you don't have no insurance, you can't get no care.
That's right. That's right.
Okay. Thank you very
so
much.
much.
Thank
Thank
you.
you.
It was wonderful talking.